Coming to the next implant, stainless steel wires. They are made up of stainless steel, hence the name stainless steel wires. Okay, so what is the purpose? First thing, they are used for tension band wiring. So what is meant by tension band wiring? When a fracture is exposed to too much of stretch forces from the ligaments, assume that when there is a fracture of the patella. Okay, so when there is a fracture of the patella, these fracture fragments are routinely exposed to continuous stress or the continuous pull by the ligaments. There is the patellar tendon below, and proximally we have the quadriceps tendon. These tendons will be continuously providing a distracting force, and if we try to put just a K wire here, okay, yes, if we try to put a K wire here, this K wire will be giving away, or there won't be union at the fracture site. So to counteract the continuous stress at the fracture site, we need to give a continuous counteracting force. So what we will do, after applying a K wire, we will put a SS wire, stainless steel wire, in a figure of 8 manner. Yes, we will putting it in a figure of 8 manner. Okay, so that this distracting force will be counteracted and it will be converted into a compressing force at the fracture site. Okay, so this principle is called as a tension band wiring principle, and for this purpose we use this stainless steel wires. So what are the other fractures where we use tension band wiring principle? Medial malleolar fractures, yes, then olecranon fractures, then also lateral malleolar fracture and lateral and clavicle fracture. Okay, then so what is the second use? They are used for the purpose of encerclage. Okay, so what is meant by encerclage? See, we take the same patella example. Yes, okay, so assume that this is a patella. Instead of a normal single fracture line, there are multiple fracture line. Okay, the patella is a comminuted patellar fracture. So in this fracture I cannot apply a K wire like this. Instead, what I will do, I will apply this stainless steel in a circular manner or in the circumference of the patella, and I will do the tightening here, so that these fracture fragments, they won't get displaced, or there will be only minor displacement, and immediately after a fracture there will be the hematoma that act like a minor paste to hold the fracture fragments at a, or they can hold the fracture fragments for some time. So we are augmenting this hematoma with the help of the circumferential stainless steel wire. This process is called as encerclage. So for this purpose also, these stainless steel wires are useful. Then coming to the one of the most commonly used implants in recent studies or in the recent ligament reconstruction. Yes, so what are these implants? This is called as a peak screw or interference screw. So what is the purpose? They are used in ACL reconstruction or MCL reconstruction or other ligament reconstructions. After applying the graft into the bone tunnel, these screws are inserted for fixing the graft ends to the bone tunnel. Okay, so they are made up of titanium, so there are no need to remove this peak screws, and the newer variants are made up of biodegradable implants also. Okay, just you know that there is a biodegradable screws available for the instead of the titanium peak screws. Then this one is called as the ecto button. Yes, since it looks like a button, this will be lying outside the bone surface to fix the suture. So it is also called as suture disc. Okay, suture disc or ecto button. And this one is called as the spiked washer. Yes, as you can see the spikes, these spikes will be acting as anchor for this disc. So this one is called as a spiked washer. They are also useful in the ligament reconstruction procedures for the arthroscopic reconstruction. Yes. Now coming to the prosthesis. So this one is called as a Thompson hip prosthesis. As you can see, the femoral head replacing part, and this is the stem part that will be inserted through the stem of the proximal femoral part. Yes, like this it will be inserted. So what is the difference between this and this? So here in Thompson prosthesis there is a collar. Yes, there is a collar at the neck part. Okay, so this is the difference between Thompson prosthesis as well as the Austin Moore. The next one, this is the major difference between whenever the patient is having the deficient neck or the deficient medial aspect of the proximal femur, then the Thompson prosthesis will be preferred. Even though these Thompson, the unipolar prostheses are absolute now, but sometimes whenever the patient is not affordable for the bipolar prosthesis, they can be used, and these are only for the theoretical purposes. No one is using them now. Yes. Then coming to the Austin Moore prosthesis. So here in Austin Moore prosthesis there is a 2 hole here. Yes. So these 2 holes, they have 2 purpose. One thing, after insertion the bone ingrowth will be happening here. Okay, so because of this they will have good fixation on comparison with the other unipolar prosthesis like Thompson prosthesis. Yes, this is one advantage. And one more advantage is that whenever in a patient with a poor bone stock we want a good fixation, then we can fill this area with a cancellous bone graft. Okay, cancellous bone graft can be filled here, then we can do the insertion. Both can be used with or without the cement process, application also. And this hole is there for the easy removal. So assume that the patient had some problem, or patient after application it's been 10 years and patient need a total hip arthroplasty, then we need to remove this implant. So for this better removal, so here there is no hole, so there is a difficulty in removal in the Thompson prosthesis, but here we will be having a hook for the removal, so that can be easily giving a hold. And intraoperatively, if we are planning to change the size, if we have miscalculated the size and we want to change the implant, so that time for easy removal this hole will be useful. Yes. Okay, so this is also a unipolar prosthesis, but they have 2 holes. With these 2 holes you can easily identify it is an AMP or Austin Moore prosthesis. Coming to the third thing, and this is the workhorse, man. Okay, because regularly in every orthopedic hospital per day they will be doing one bipolar prosthesis. So what is the indication? Fracture neck of femur. And sometimes now in an elderly patient, if the intertrochanteric fracture is very unstable or the patient requires early mobilization, then we can prefer a bipolar prosthesis. But the first and foremost indication will be a fracture neck of femur, and second thing non-union neck of femur. Then the third thing is the unstable IT and the patient preference. If the patient wants early mobilization, then we go for a prosthesis, which will be a bipolar prosthesis. So why it is called as bipolar prosthesis? Because regularly my chief used to ask this question to the undergraduates. Since we all know, if there is a 2 poles, if we are mentioning, we know that north pole and south pole, 2 things will be there. But here there is only 1 pole here. Then why it is called as a bipolar? So for this you need to look into the detail. See, here it is 1 pole and here there is 1 more pole. So what is the difference, sir? Basically both are looking like same thing. There is a ball at the tip. So what is the difference? Yes. So for this you need to understand this. So what happens? See, in the unipolar prosthesis, once they are inserted into the acetabulum, the movements happens between this ball and the acetabulum. So what happens? We are replacing only the femoral head part. Yes. So this acetabulum is intact, which means the acetabular cartilage is intact. So this being a metal and have more consistency than that of our normal body bone surface. So on continuous usage, assume that after 5 to 10 years, there will be erosion of the acetabular cartilage. So the patient will be ultimately ending up with a total hip replacement for the arthritis at the acetabular surface. But on the other hand, in patient with bipolar prosthesis, the movements initially for 1 to 3 years, the movement will be happening at this head. Okay, there won't be any movement, or there will be minimal movement between the femoral head and the acetabulum. So the acetabular cartilage, that is safe for at least 1 to 3 years. But due to this thing, some wear and tear from this polyurethane or the polymer part, there will be this thing stiffness, or this movement will be restricted after 1 to 3 years. Okay, after 1 to 3 years this movement will be restricted. So even this bipolar prosthesis will become unipolar after 1 to 3 years. Okay, now in the advancement cases we have this thing modular bipolar, in which we can have this thing, customize this thing. We can have a separate femoral head size, and we can have a separate this thing stem size. Assume that a patient who is very thin, okay, very thin, and he is very tall. Okay, so in that patient, even though the femoral head, the size of the femoral head is small, but since he is very tall, yes, very tall, the stem of the femoral head he require will be the more. So in that patients we will have to customize it. But since in a normal regular bipolar, the whatever that is available, that is of the this thing already ready-made available, we cannot change intraoperatively. But in the modular bipolar, just like that we can change. So this will be available separately, this will be available separately. So we can customize based on the requirement of the patient. So then, so this is the comparison between these three. So here, if all the three implants are, all the three prostheses are kept before you, you can easily identify them. If there is a collar, then it is a Thompson prosthesis, and if it is a unipolar with the 2 holes, then it is the Austin Moore prosthesis. If there is a bipolar, then you can say clearly it is a bipolar prosthesis. Then coming to the total knee replacement prosthesis. Here generally we do total knee replacement mainly for the osteoarthritis grade 3 and 4, preferably grade 4, and even in patients with rheumatoid arthritis or secondary arthritis due to the post-articular fractures, intra-articular fractures. If even after treatment they end up with the post-traumatic arthritis, then we prefer to do a total knee prosthesis in elderly. So what are the components of total knee replacement prosthesis? See on the frontal view, yes, there is a femoral component which is nearly a semicircle, yes, and there is a tibial component. So this one is a tibial component which will be inserted in the proximal surface of the tibia like here, and this femoral component which will be inserted in the distal articular surface, replacing the distal articular surface of the femur, and between them to replace the cartilage there will be a plastic spacer or a polymer. Okay, there will be a polymer. So this will be giving the maximum stability to the replaced knee joint. So this maximum stability is made sure by the cam post mechanism. Cam post mechanism. This is the cam post mechanism that will be giving the hold for the distal part of the femur and the proximal part of the tibia.